Next slide.
Hi there, everyone. So for today's learning objectives, we wanted to provide a space and an opportunity to develop a further understanding of grief in the context of systemic oppression, to really explore examples as emerging strategies. So we'll provide those throughout our presentation and hope that we'll have an opportunity where you'll feel comfortable to do so during the Q&A at the end, as well as participate in a reflective practice throughout today. Next slide, please.
Okay, so thanks for the introduction, Joshua. Um, we just want to introduce ourselves individually and sort of situate ourselves on the land and situate ourselves within identities. So my name is Jennie Biltek. I'm a white, middle-class, able-bodied woman. I use she, her pronouns. I'm fifth generation settler of Slavic descent and a second generation immigrant of Irish Celtic descent. My people hail from the foot of the Carpathian Mountains in what is now Poland, the rocky mountain shores of Western Ireland, and the marshy lands of County Cork. I acknowledge and I honor that I work and live on the unceded, stolen, and traditional Indigenous territory of the Scheible and the Squamish people, known colonially as the Lower Sunshine Coast, BC. And I pay my respects to the Scheible and Squamish elders of the past, present, and emerging. My home and where I'm coming from you, or where I'm coming from you today, is nestled between the shores of the Salish Sea and the banks of a creek, near a really ancient Scheible village of Sokum. And the eagles, herons, ravens often fly overhead here between their nesting and their feeding grounds. So I was born and raised on the lands and in the waters cared for since time immemorial by the Plains Cree, Beaver, Denunde, and Métis people, Métis people, including Kelly Lake Métis Settlement and the Mountain Métis on what is colonially known as Northern Alberta. So the topography of this land is that it's very flat, so much so that the mountains, which are nearly 200 kilometers away, the way the crow flies, you can see them. And what that land taught me and continues to influence me is it's taught me about perspective and how my understanding of something or someone changes depending on my relationship with them and my proximity to them. And so the lands where I now live hold me really gently. This is a land that really has held me very gently and has taught me a lot about grief, a lot about tending to grief. And it invites me in a different way to get very up close to things. So, and I'm learning about the animal and the plant kin here. So both of these places have really influenced who I am and the lens through the which I relate to others and self. Thanks.
So next up is myself. My name is Stephanie. My pronouns are she, her, and I am a white cisgendered woman. I am a researcher, a registered social worker, a PhD candidate, and as Joshua mentioned, the director of operations for the Kelowna Homelessness Research Centre. I was born in Ontario, very close to Tyendinaga Mohawk territory, and spent the majority of my life there until I moved to Kelowna to finish my, what at the time thought was finishing my education with a Master's of Social Work. And yet here I sit, splitting my time now between Kelowna, acknowledging the Silks Okanagan Nation and their peoples in whose traditional, ancestral, unceded territory Kelowna is situated, and I spend my working time mixing that with Calgary, where I'm coming today, in the heart of southern Alberta, both acknowledging and paying tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, the Tsuut'ina First Nation, the Stoney Nakoda, and the Métis Nation of Alberta, Districts 5 and 6. I'm very grateful to spend my time between these two places and to still call Ontario home, but to have opened up that meaning of home to myself and been welcomed in these lands. Jaylene?
Thank you. Itaquail, which is good afternoon in the Sechelt language, the land of which I am situated on and joining from today. I live and work and do community care on the traditional territory of the Seashelt and Squamish Nation. I'm a neighbor very close to Jennie Biltek, so I am close to Sokum Creek, and an honor at this time of year, this time of the season, to be getting to go for walks and watching the salmon return, getting ready to do salmon spawning. Um, I live at the edge of the ocean, which is such a beautiful gift to me, and it really embodies for me and holds me in the community care work I do. It feels like a place in between worlds, the land and the water. Um, Getting to watch and witness the humpbacks and the orcas move through this time of year following the salmon. I was born on Mokinsa's territory, which is Blackfoot language. It's the traditional lands of the Tsuut'ina and Siksika um, people. And I am a white cisgendered woman. I use she, her pronouns. And I live with chronic illness and invisible disabilities. I'm also a solo parent and have been for over 20 years now. Next slide, please. So we want to invite everyone joining us today, if they would like and they haven't done so already, to introduce yourselves in the chat. If you want to name the land, um, and the names of the Indigenous people who have stewarded this land, please, we welcome you to do that. And we invite you to take this moment to situate yourself on the land, and asking yourself how you arrived here, and how you came to call this place, maybe now that you're on, as home. Your ancestors, the paths of their migration, immigration, as refugees, as uninvited settlers, what brought you here to this land. I want to take a moment to think about what we and feel, what we see, hear, and feel and sense that can connect us to a place. When I look out my window, as I said, I get to see the ocean. There's a big cedar tree in my front yard. And I can hear a lot of human sounds, but if I expand my listening out, I can hear some birds and some human noises as well, some machines going on in my neighborhood. Um, what we feel in this place that we're on, and that can be bodily sensations, that can be emotional sensations that come to us, and what we sense that connect us to this place. And this is an important practice. We always believe, to situate ourselves on the land in doing the work that we do. Next slide, please.
Okay. Thank you, Jaylene. So I think, to invite folks to share as we continue to speak. So we really want to name that this is not a how-to session. There are not, 10 steps to creating, to doing this work. And, what we want to do here is share our experiences and what we have learned. The three of us arrive with very different lived and living experiences and work experience. So, and looking forward to sharing that with you. So today is really about inviting curiosity, being open to exploring ways that may be new or unfamiliar to you, or if they are familiar to you, questioning what could be different and perhaps hearing different perspectives. It's also about deepening an understanding of grief in the context of systemic oppression, specifically among those individuals and communities that are unhoused, precariously housed, who use substances, who are impacted by the toxic drug crisis. And this includes frontline workers, care partners. We also intend to explore and offer examples from our own work, our own lived and living experience as emerging strategies to inform ways to work in grief and bereavement. And I think at the heart of what the three of us hope for today is to invite you and the organizations of which you are part of to begin situating yourself in the practice of building compassionate relationships with those individuals and communities who are so often dismissed, diminished, and harmed by society, and who experience such vast grief. Next slide.
So I'd like to take a few moments to frame a bit of the conversation before moving into brief definitions of how I've come to this space and work. In 2023, the BC Centre for Palliative Care and the KHRC partnered on a research study on the lived experience of bereavement in the context of homelessness. And the goal of that research was to better understand the bereavement experiences for those with lived experience and to understand what is needed to improve grief support moving forward. So some of you may have attended a previous ECHO session where Joshua and I have spoken about our work. That initial research study has led to a longer-term partnership where we've continued to explore the impact of community memorials in Kelowna. We've created a documentary, memorial toolkit that'll be upcoming, but it also led to opportunities like connecting with Jennie and Jaylene to foster opportunities to create community together and to offer us a place to land. And so that's led us to today's presentation as well. And to contextualize kind of some of the definitions that we'll be using or that we kind of turn to as we engage through today's presentation, we just wanted to take a moment to provide some of those. So you'll see on the screen that we have systemic oppression. We're understanding this as discrimination and unequal treatment of historically underserved groups. When we think of systemic oppression, we think of racism, colonialism, ableism, transphobia, housing precarity, and poverty. Often people will use the term marginalized in this context, and we wanted to take a moment to name that people are not marginalized, they are systemically oppressed. We also have grief here, which can be understood as the response to the loss of something or someone important. While traditionally understood as a response to the loss of someone through death, we also experience grief from a loss of identity, a loss of culture, community, loss of safety, such as harm that can be experienced within the healthcare system. Grief presents not only as an emotional response, but it can be a physical, cognitive, behavioral, social response. Next, we have bereavement. While grief and bereavement have been used interchangeably, bereavement is considered to be that state of loss, whereas grief is the reaction or response to the loss. For layered and compounded grief, this is typically referred to when multiple losses occur, either simultaneously or they're experienced over time without adequate healing opportunities in between the losses. And this type of grief can be so challenging as new losses intensify or trigger an emotional responses of the previous losses, making it all the more difficult to process and heal. And this can be particularly felt by frontline workers and peer workers who are also dealing with disenfranchised grief, layered and compounded grief, but that disenfranchised grief, which can refer to grief that is not acknowledged or validated in society. Grief may be chronic, it may be disenfranchised, it may be invisible. We also encounter unmet or untended to grief with clients who are living in a state of emergency and survival. And in our research, participants have often identified not having an opportunity to grieve because they are focused on survival. So now that we've framed some of these definitions that we'll be using today and kind of context the conversation, Jaylene is going to talk to us about why that's so important and why it matters. Next slide, please.
Thank you, Stephanie. So why looking through the lens of systemic oppression matters is because we are living and working within systems of colonialism and capitalism, which has been normalized by calling it civilization. These systems are woven into the structures of our organizations and institutions. We first define neutrality and objectivity with our language because language is used as a weapon in these systems. Neutrality is complicity when these systems kill people. We do this by power analysis and naming that these systems create the conditions of disconnection, abandonment, and poverty. They are oppressive and have created unlivable conditions. We then stigmatize people's survival, resistance, and response. The word stigma comes from the ancient Greek language. It was used to refer to a mark or a brand that was physically burned or tattooed onto the skin of slaves or criminals to denote their status or wrongdoing. Over time, the term evolved to signify not only a physical mark, but a metaphorical one, a mark of shame, disgrace, or disapproval associated with a particular circumstance or a racialized group. Our medical and mental health system then defines people as sick or disordered in order to pathologize them. To pathologize someone is to regard them as psychologically abnormal, rather than seeing people's behaviors as injuries and responses to being disconnected and abandoned. I ask us to reflect on the question of what we have done as a society to make drug use with a toxic drug supply a reasonable response to suffering. What have we done to make abandoning the most vulnerable people the norm? The ruling class has had to push the myth of personal responsibility so we don't realize that most of people's perceived failures are actually systemic. Language matters when it normalizes control, dominance, hyperindividuality, and coercion. Sasha Bloom asks, is a flower disordered for not being able to grow in poisoned soil? Ruth Wilson Gilmore, who is a prison abolitionist and scholar, presents us with the concept of organized abandonment, which she names as the intentional disinvestment in communities, which in turn creates opportunities for extraction, revenue generation, and carceral enforcement to fill the cracks of a compromised social infrastructure. We have sayings about this. We say that people fall through the cracks or get pushed to the margins, but these are necropolitics. They are policies and laws that kill people. And the purpose of this violence is to benefit the state. There is so much disenfranchised grief from this organized abandonment. Community care and service providers will perpetuate these cycles of violence when the grief from this systemic harms are not acknowledged and inform the way that we approach community care. Compassion is a feeling, a sensitivity to the emotional pain of others. And this brings us to the question then of how compassion informs the way we meet people who are suffering within these systems and help us create pockets of justice doing. This work is not easy, it is messy, and it's non-linear. We are living in times of emergency and urgency, and yet this care does not move quickly. It invites us to slow down. We know this in grief, bereavement, and palliative care, that grief is a landscape. It is a landscape layered with other complexities for people who are living systemically oppressed. These communities have to engage with the systems in order to survive. So the mistrust of organizations and institutions makes sense. John M. Perkins, who is a civil rights activist and author, so succinctly said, "You don't give dignity, you affirm it." In this work, we hear the expression telling us to meet people where they are at, and we will talk more about that throughout this conversation. I will challenge us to go beyond this kind of thinking. When we are looking through the lens of systemic oppression, people's behavior makes sense, and we start to see that people are always trying to find safety. So again, compassion is a feeling, a sensitivity to the emotional pain of others. We then take up the work of acknowledging and naming systemic harm and violence. Invite you to find ways to collaborate to grow ecosystems of care for people impacted by the toxic drug emergency and those living homeless and insecurely housed. I believe that this is a starting point from here for emergent strategies for pockets of justice doing. Next slide, please.
Thank you, Jaylene. So I want to speak a little bit now about why compassionate relationships matter, particularly in the context of social service organizations, institutions, and work. So what we feel is important to identify as a group is that just because we offer care and support does not automatically mean that our offerings, our organizations, the institutions in which we work are compassionate. And we have to name and identify that all of us in some way are a part of systems of oppression. So we contribute to them, we benefit from them, and we are also oppressed by them. So second, let's also consider, take a look at the role of compassion in our work. No matter what kind of work you're doing, whether it's volunteer role, whether you're working for a large organization, whether you're in the not-for-profit world or entrepreneurship or in the medical field. So people who have experienced trauma at the hands of helpers, including medical systems and systems of so-called care, have developed really warranted mistrust or complete distrust of helpers of all kinds. So even though, we might believe that what we're offering is compassionate care, it doesn't always mean it's going to be received as such because people are arriving with these experiences. We are, as people, working in helping fields, we're inheriting past experiences with institutions. So as such, we can't assume that we know the way, the path, or what kind of a care an individual needs or benefits from. So, excuse me, we cannot assume, as we've already referred to, but we're going to reiterate again, that we are a safe person or have created a safe place or a safe space because we identify ourselves as being compassionate. A sense of safety is not something that we can name. It is something that individuals can only name for themselves. So all that said, compassion is a starting point towards equity. It's a place of beginning and curiosity, a place towards equity and repair. So it allows compassion allows space for recognition, for acknowledgement. It allows an opportunity for connection, and it allows an opportunity for relationality. So through the lens of compassion, we can acknowledge harm that's been done or is ongoing. And as Jaylene named, that gives us an opportunity to name that within ourselves and then see how that relates back into for others. We can practice connection through shared experiences, and that can be something as simple as like going out for a cup of coffee, or acknowledging an individual. And compassion asks us, for those of you working in grief and grief bereavement and palliative care, you'll know this. Compassion asks us to be consistent. It asks us to show up repeatedly without expectation of reciprocity, including choices we might make for ourselves. So even though another is making a choice we may not make for ourselves or our loved ones, we show up anyway. So this kind of approach, it helps to build trust very slowly, very messily, but over time. So what we're proposing then is a compassionate approach can be an emergent strategy for care and repair. Next slide, please. Next slide.
So I'm going to speak about how we build compassionate relationships with individuals. I've worked for the last 5 years doing frontline work in shelters, supportive housing, and also doing peer programming, which was supporting peer workers working at the overdose prevention site in my community, and peers informally doing this work. Um, Speaking about cultural humility and not competence. Um, so before that, sorry, I want to backtrack. Um, we are witnessing in that and experiencing the crumbling of systems all around us. Community care and social services, as we know, are being eroded and defunded every day, every time we turn around. The toxic drug emergency has been ongoing for over 9 years now, and the number of people living homeless and facing housing insecurity grows every day. The care work that I've been doing, as I mentioned, for the last 5 years, has been in service to a community that is already living in collapse. I believe that the toxic drug emergency and homelessness is the great intersection of all the polycrises that we're speaking of at this time. It is an ongoing genocide of Indigenous people. In BC, the death rate from toxic drugs is 6 times higher for Indigenous people and 11 times higher for Indigenous women. I always feel it's important to say these aren't just numbers. These are people in our community who we love and care for, who have family and friends. And so when we talk about caring for this community, I believe we have to name it for what it is, that it's death work, it's never-ending grief and bereavement care. So cultural competency can be understood as universal principles such as understanding and compassion that people come from different cultural backgrounds and identities. However, it's not enough just to acknowledge this, and that can also lead to stereotypes, stigmatizing, and criminalizing, and it does. This is a power dynamic that often shows up in organizations and institutions, and to a lot of the talk that we hear today about reconciliation. Reverend Dr. Shalita A. Mira talks about cultural humility being the heart of social justice and says it is critical that we move beyond sympathetic responses and practice deeper transformative empathy. We must transcend from cultural competency or the knowing of another and strive to practice cultural humility or the experiencing of another. Cultural humility requires power analysis, not just awareness. It's a paradigm shift from awareness to experiencing, from thinking to being, and from externalization to internalization. The awareness of injustice is the first step into understanding that this is an us problem, not a they problem. It is through humility that we experience humanity. And I'm going to share some of Reverend Dr. Mira's framework when we send out the resources, because I've learned a lot from it. And I want to challenge this phrase that we so often hear telling us, oftentimes in the training that we're receiving in the workplaces, about meeting people where they're at with no real skills or framework offered to us of how to do this. I personally don't believe that we can meet people where they are at when we have not shared common experiences of oppression and suffering. I can't meet people where are at when I have not been there, but I can tend to those relationships to grow enough trust with people to be invited to walk alongside them. Being an ally in this work is not enough. I work to be in solidarity and I tend my own discomfort and hard feelings to learn skills of humility to allow me to be in solidarity. This is why it is so important to locate oneself on the land in our identities and our privileges, and again, really feeling and knowing where and how we are complicit in this. I hold close always the words of Susan Sontag, who said our privileges are located on the same map as their suffering. So there's so much, as we continue to talk about, so much unmet, untended grief for people living in states of emergency and survival. This grief is often chronic, invisible, disenfranchised, and unacknowledged. There are so many complexities and layers that we can only see when we do the work to see it. The expressions of grieving and coping when trying to survive these systems are stigmatized, criminalized, and othered. And I'm always questioning how we can create safer spaces for this grief. Knowing that frontline and peer workers are doing this work within their own landscape of personal lived experience while also trying to care for community. I'll be sharing examples about these expressions of grief and how we make room for that. So these systems bind us to policies and procedures that don't actually allow us to walk alongside people. So talking about creating a relational pace, not an institutional pace. Oftentimes programs become templates or some kind of prescriptive framework, and I have witnessed and experienced harm every time this model is adhered to. Every individual has their own needs, every community has their own needs. But as humans, we all need safety, belonging, and dignity. So we move at the speed of trust. And I see this as a strength within hospice and palliative care work. And so I've been curious and working alongside hospice to see how the strength from this sector can be a foundation of bringing forward grief and bereavement support for systemically oppressed communities. When we talk about active, respectful listening, to learn about listening, I think the best way to learn is by observing the non-human kin that is around us, the cycles of the seasons and nature. They teach us how to be in relationship, how to tend and mend and listen. And words that root us in relationality offer a framework for how we find ways to listen. Words like tending, resonating, soothing, witnessing, expressing, feeling, flowing, tracking. When I feel into these words, it shifts the power dynamics and it shifts my responsibility. We can ask, what do you need that isn't being fulfilled instead of here's what we offer. Next slide, please.
Thank you, Jaylene. The words of Dr. Holly Prince have really influenced our conversations, and that is that to move at the speed of trust, and that's really been influence the conversations that we've been having. So, where I want to turn our attention, Jaylene spoke a little bit about working with individuals. I want to shift the looking at, so how do we grow these kinds of relationships within our own organizations or institutions? So you've been doing a lot of listening. So I'd like to invite us just to take a very quick 30-second reflective practice. And just in the chat, thinking about where you're working. So, or if it's in a volunteer capacity, so if it's in the medical field or a not-for-profit organization or whatever kind of wherever you're working, is take 30 seconds. And if you are comfortable doing so, is name who is excluded in those spaces in your organization and your community. And if you're not really sure where to start, then I just draw your attention to the social determinants of health. We're going to talk a bit more about those in a second. But just using that as kind of a jumping off point, who is currently excluded in your spaces? And it may not be an intentional exclusion, but who is not showing up in your spaces? So leave that with you to sort of think about who's not there. And before we move on, next slide, please. So we've heard a lot about social determinants of health. If you're working in the healthcare field or healthcare adjacent, as I call it, this lingo around social determinants of health, which we wanted to name here sort of like a very like nice, compact way of naming what's really happening, which is these are systems of oppression. These are the ways in which people have been oppressed. So, excuse me. Um, so these factors are in place. Sorry, each of these factors are in places in which people are unhoused, are using soft substances, and it's something we want to acknowledge is that when we talk about social determinants of health, it sounds like something over which we have a lot of control, and that's very often not the case. Okay, so within organizations, so how do we grow these compassionate relationships? And going back to our intent is like this is not a 5 steps to doing this. But there are some questions that we feel can provide a bit more information. So when you're thinking about the team or the organization in which you're working and you're doing your work. So again, who is excluded in those spaces and organizations and community? How are you as a group responding to grief and bereavement? And who is not included? Who's excluded in that response? So, as an example, is your organization able to respond to all kinds of communities and identities? Or, if you're really honest, is your programming really designed for cis white heteronormative middle class people? And even if we believe, like, I think it's very common for us, right, to believe like our programming, our space, our care is like it's available to all people. But if those individuals or those communities don't feel safe enough, welcome enough, that's going to be reflected in who's in the room and your registration lists, who's on your clinic appointments. And so it's not necessarily, we're not here to create like a laundry list of things to do. It's really about coming from a place of curiosity. So we don't want to get trapped into that. One of the lies of colonialism is like a to-do list of things I need to do in order to be better and more perfect in the world. This is really coming from a place of curiosity and a place to start. And linked to that question around how are we responding to grief and bereavement is what kind of harm as an organization maybe we're perpetuating. So, and that could be like, does our space really feel like, is it in a location that is accessible for everybody? Is it on a bus route? When someone comes in the door, what are they confronted with? Those kinds of things. So this is not a call to action to apologize. It's an invitation to get clear on what kind of harm can be addressed. And yes, in some cases, there may be an invitation there to explore repair, particularly around, individual interactions. But it's more about coming from a place of curiosity. So we invite you to engage in this kind of reflection, not because, again, we need to create some kind of to-do list, but because it is a place to respond. An example I want to bring forward is um, about 2 years ago, Jaylene and I were asked by somebody in community who was supporting a group of people who were living up in the forest off grid, which is a very common experience here. Um, and it would not have made sense to have that meeting in the hospice programming space. First of all, it's not on a bus route. Second of all, there's still an institutional factor. And so we talked a lot about what is the kind of space that we could hold this kind of circle to talk about a number of losses this community had experienced that would be more accessible. And so we chose a community garden, which was for most of them within walking distance. We offered the opportunity for transportation. There were food and snacks there. So it's a very small example of how organizationally we can think about ways of making small changes so that the individuals we're wanting to support feel that they can be in those rooms, as it were. Next slide.
So I'm now going to talk about how to build compassionate relationships with community organizations, with the very large caveat that we've been saying from the beginning that this is not a prescriptive list, but something that we invite you to consider and something that we ourselves think about. So you'll see on the screen here that focus on relational pace, not just institutional pace, is kind of bigger than all of the rest of the text. But what does that mean? So relational pace is grounded in social justice, decolonial and community engaged practices. It refers to the intentional slowing down of project timelines, communication, and decision-making processes in order to truly center relationships, trust building, and mutual understanding, particularly when working with people, communities, and cultures that are systemically oppressed, systemically. Um, Rather than focusing solely on efficiency, outputs, or deadlines, which often is what occurs in a lot of our work and is a more transactional or institutional pace, relational pace prioritizes people, process, and context. So it recognizes that meaningful, lasting change, especially in community partnerships, requires time, humility, and reciprocity. So what does that look like in practice? I invite you to share your own examples and thoughts in the chat. I'll be going through some through speaking about some of these components here too, but we invite you to consider it as well. So we start with listening, not proposing. Before even suggesting projects or partnerships, attending community events or meetings as a guest is so important. Just showing up, listening, and learning. And we suggest this because it demonstrates respect for the existing work that's already happening and helps you understand priorities from community's perspective as well. So as a personal example, I have been very grateful to be a standing guest at the Lived Experience Circle on Homelessness meeting every month in Kelowna. Sometimes I have news to share on what KHRC is working on, or requests to collaborate, or think about ideas for new proposals or work that we'd like to do. But the majority of my time at these meetings is as a guest that is simply listening and learning. This opportunity to attend as a guest has also given me an opportunity to better understand what LECO's priorities and concerns are, and how we might be able to thoughtfully and carefully collaborate on projects in future. And it's through listening that I've been able to build strong relationships over time, which leads us to our next piece of building trust over time. One way to do this, I know Jennie mentioned earlier, is scheduling informal relationship building activities and check-ins. So things like coffee chats, shared meals, walking meetings with community partners that don't have an agenda, don't necessarily have an activity to check off, or a piece that we need to accomplish. We do this because trust is built through consistent, low pressure connection, not just during high stakes collaboration or with a goal in mind. And it also creates space for potential compassionate relationship growth. So another example of this could be how I've worked to build trust with community members of LECO. So I'll tell a bit more of an in-depth story in a moment of how that relationship has grown over the years. But for this example, I'd been just dropping off some paperwork or something for another project for a member with LECO, and I was invited in for tea. And that moment just set the stage for us to further build trust, to continue to just have tea together, and build a relationship as opposed to collaboration on projects as our only activity. Now, it's also important to name mistakes, because when we rupture something and we repair it or spend the time to repair it, that also grows trust. So that same individual that invited me in for tea, I had made a mistake early on in our relationship, and I was corrected in the very beginning of that work, and I'm grateful to have been corrected and to have had the opportunity to grow trust. So my mistake at the time was being a new researcher. I provided food at a focus group for folks with living experience of being unsheltered in Kelowna at the time. And that food was food that many people couldn't eat. So it was apples, it was hard granola bars and the like. And I think that example is likely an example of a mistake that many of us have made in this work. But it was with that mistake that I was corrected and haven't made that mistake since. But it also allowed for an opportunity for me to repair that mistake and repair that relationship so that we could further grow trust and work together. In order to move forward in engaging with community, one of our pieces or with other organizations is to co-create and not predetermine. So using collaborative planning methods with community visioning sessions or co-design workshops, sharing ownership of goals and processes really strengthens relationships and ensures relevance to the work that you're doing. So a story, I'm full of stories today, to share with you to highlight co-creation comes again from the mistake of having predetermined. So in 2019, the KHRC, when we were first setting out our work, we engaged in a project to understand the factors that made individuals vulnerable to homelessness from the lens of those with living and lived experience locally. So it was a very local-based project. And initially, the research project followed a fairly standard flow, from which, the academics kind of come in, they plan the research protocols, they envision analysis, we envision how reporting will roll out. But early in that process, folks from LECO, the Lived Experience Circle on Homelessness, we had met during that planning process to gather some early interest holder feedback. And from that, we were introduced to Sherry and Dorothy. And initially, Sherry and Dorothy were seen as advisors to the team. However, their role quickly grew to full research partners. So examples of their valuable input included how to structure the opening moments of focus groups, again, the kind of food to provide to participants, how honoraria should be delivered. Their in-depth knowledge and insight initiated significant evolutions to the data gathering process and to our analysis design. And while the examples above might be seen as potentially small changes, they resulted in unexpected levels and depth of participation and relationship building that has continued to this day in Kelowna. So what began as simply including the voices of those with living and lived experience quickly moved to something far more significant. And I'm sure many of you have heard the phrase, nothing about us without us. And this sentiment expresses what many people with living and lived experience want others to know. When doing research, creating programming, designing policies, the voices of people with living and lived experience should be present and persistent throughout the whole process. So our co-researchers, Sherry and Dorothy, were instrumental in many different components of the process. And we have continued to partner with them and build relationship in order to ensure that we are doing work, or we can never ensure anything, but in order to address these pieces so that we are building compassionate relationships in the work that we're doing. Sherry and Dorothy are co-researchers who assist in designing pieces. They also co-facilitate focus groups, encourage participants to attend, and create safer spaces for participants to contribute. Their insights changed the collective approach to delivering focus groups, and their analysis and insights during analysis were invaluable in grounding our work. And so I really want to highlight that Dorothy and Sherry were no longer participants in the research process. They were co-creators, they were teachers, they were analysts, and they were equals. And consciously making that shift changed the very nature of the research process and ultimately what could be achieved by the KHRC. The work itself is important. I'm not negating that, but just as important, if not more, is the reflection of the co-researchers during and after the work was completed, because those relationships were built on trust. They were built on humility. They were built on the ability to engage through co-design. Next up, we have being transparent about timelines and flexibility. So sharing your institutional or funder deadlines, for example, asking partners how they work best and build in buffer time for reflection and feedback. And I will be the first person to say I struggle with this too. We are often, especially because so much work in the research and social service realms can be under-resourced, People are often at or over capacity. I am constantly, struggling with timelines and flexibility when it comes to the institutional pace and reconciling that with relational pace. So being transparent about timelines and flexibility helps to respect different organizational capacities and avoids extractive or rushed processes. This needs to be a continuous work in progress when it comes to working with other organizations. We also want to reflect together and set aside time during or after collaborations to reflect together on what worked, what was challenging, and what could improve. Reflection is a key part of learning and deepening relationships. It is not just completing tasks or striking something from your to-do list. Compensating for time and expertise, paying honoraria, a genuine honoraria, providing support for travel, childcare, meals, when asking for time and expertise from community partners is the bedrock of a relational pace, in my opinion. We need to value relational labor as it helps repair power imbalances and shows respect. Related to our transparent about timelines and flexibility and all of the pieces that we've talked about today is truly staying consistent and following through. So maintaining communication after projects end, as opposed to being extractive, kind of jumping in and pulling back out. We need to follow up with deadlines, with check-ins, and invitations to continue the relationship. This will show that the relationship matters beyond a one-time deliverable and allow for that trust and compassion to grow. Relational pace is about slowing down to move meaningfully. It shifts the focus from doing for to being with. And in community work, it's a key foundation for ethical, inclusive, and transformative collaboration. And I know Jennie has used this phrase today, Jaylene has used this phrase today. I will now join our group in saying, as Dr. Holly Prince, an Indigenous researcher on palliative and end-of-life care, talks about, we are moving at the speed of trust. Next slide, please. Before we open the floor for questions, reflections, or stories, we want to leave you with this closing thought. Compassion doesn't replace systemic change, but it can inform it and make space for changes to take shape. So thank you for being with us today. And next slide.
Wow, I loved it and I learned a lot and you guys have all have very sort of like unique perspectives, but it's all coming from a very beautiful place of understanding the language we use, the systems that we're in. And personally, I'm still understanding the biases that I carry, the systems I work in, and it's a learning process. And I really like, Stephanie, how you really mentioned when it comes to building trust, you're going to make errors, you're going to make mistakes, and it's really repairing that actually strengthens the trust because they're seeing also what do you do or when a conflict happens or you make an error of some sort. And how do you respond to that? Because that tells a lot about a character and someone's motivation as we move forward. And when you said that, I was like, oh yeah, it's so true. And so a lot of times, I know I do. I have a fear or anxiety of saying the wrong thing or doing the wrong thing when building relationships. But it's also, I think, letting that go and knowing if that does happen and you're open to that feedback, then you won't do it again. So I think it's encouraging that repair is part of the work and being and not being afraid of it, but just open to be able to hear that the changes that we can make as we move forward to build that trust. So thank you everyone for just all your knowledge and wisdom as we all trying to build a better place and build trust in different populations and communities that maybe we never had at this time. And so I want to know if there's any questions that anyone has in the group. Feel free to raise your, I guess, Zoom hand. It'll pop you up, or you can ask it in the chat. We have about 10 minutes for discussion.
Esther, can you go back to the last slide, please? There's a request. Thank you.
I was paying attention to the chat a little bit as well, as much as I could, and I noticed that there was some reflection when Jennie had asked about who is excluded from services. And there was a number of comments speaking to that people that are using substances, not accessing services, people that are living homeless and in poverty. And I hope that we can just take a few minutes to talk about that because that's some of, I know, the work that Jennie and I have been collaborating on in this community. Jennie, do we want to talk about that for 2 minutes? Just because I feel like that is part of a question that was feeling like it was coming out of the chat for me.
Yeah, I mean, to be perfectly honest, this is um, where community relationship is really important. So, Jaylene really asked when I was previously in my role at hospice, Jaylene really encouraged and asked that um, were there ways that the organization could provide grief support, and so we collaborated in lots of different ways. A big part of that was being able to be introduced by somebody, Jaylene, in community who is like deeply loved and very well respected by the by the organization who runs supported housing, who runs the OPS here, who supports tent encampments. And so those introductions were really valuable and allowed a way in. So, um, and what I learned in the very small amount of grief support that hospice offered that time and that I'm hoping will be continued in the current work that I'm doing is that I think our belief is that the response has to be really complex and deeply thought out and have some kind of process around it. And really, it was just about being present and saying, um, you know, I'm here to listen. Um, there was a couple of times where Jaylene just asked me to come down to the OPS after someone had died and we were just there to listen and be with community. Um, so I'm sure Jaylene has more to offer about that, more from a different perspective. What it did require, I will say, is that and I always appreciate this example, is like you may be the person standing in the water, the only person standing in the water, with everyone else in your organization standing on the shore saying, it's actually quite pleasant in here. Please come and join me. It can be quite a, it can be quite efforting to be the person being like, we can do this. We can become more relevant. We can address needs. Um, and having collaborators can be very helpful in feeling sort of like you're not a solo voice in that.
Thank you, Jennie. Yeah, I mean, what I want to add on to that is really that I think of this work as again, like creating ecosystems of care. And a lot of that for me in the work that I've done and been able to do is by individual relationships, whether that's with people that are working in organizations and institutions, and forming relationships there, and with my peer community, peers being people that I'm working alongside doing community care for. And I think it's a very tangible, real inroad for hospice to look at, like, a starting point to look at finding ways to support frontline um, workers and peer workers for grief and bereavement support. And that would look like finding ways to get introduced or be introduced to folks working at a local overdose prevention site, or folks that are working at the shelter or in supportive housing. Um, there's As I've said, these are people that are living in the landscape of their own lived and living experience often, and are tending emergency all the time, and have very little care around that, and very little space offered for grief and bereavement. And so I think it's a real tangible thing to look at how hospice organizations can grow relationships to offer some of those grief support services to frontline and peer workers working in the toxic drug emergency, and um, in our shelter spaces and supportive housing.
I wanted to reflect, thank you, Jaylene. I wanted to reflect on something Stephanie shared earlier about repair, and Joshua, that you talked about. Um, I think one of the things that I've learned, and it has been really helpful for me to experience, is that we have a lot of fear, as was named, about making mistakes, about showing up in the wrong way. And what I've learned is that even when the inevitable will happen, which is we'll say the wrong thing, we'll show up in the wrong way, is that it actually creates this really beautiful opportunity to create a point of connection with an individual, not necessarily with an organization, but with an individual perhaps who has never had somebody say, um, I'm sorry, my words, my actions, I'm sorry that that created harm. And so I really encourage you that if you are concerned, like, I don't know, I don't have the right language, I don't know how to approach this. Yep, probably not. Um, that's okay. And reaching out anyway, to folks who are doing this kind of frontline work is worth doing. And you might get lots of no's. When I at hospice, it took about a year for hospice to get in to talk about how to support an individual who was living in supported housing with a palliative diagnosis. And that was in reaction to an incident. It took almost 2 years for the supported housing team here to reach out and say, hey, we've had a death of one of our housemates, our residents. Could you come and support community and support staff? That took 2 years. So it's a very slow process, very slow process. Yeah.
I enjoyed that. You guys did another small talk right there, and it's just as I said, like I could continue to listen to you and learn from you. And I think one of the big things too that I've heard along the way too is when we approach these spaces, to not think that you're here to save them or that you have everything that they need, because then you're not listening. And as you guys, everyone has said, so it's really about listening to see what they need and to be in those spaces and to reflect from that. And that creates a different kind of space to being open and the ability to learn with humility with the new communities that we approach. And so, are there any other questions? We have about 2 more minutes, and then I'm gonna wrap up. If there's not, Ken, I noticed that you don't have your contact information on a slide. So could you put it in the chat so people know where to find you if they want to? And we'll also put it in the handout that we're gonna provide everyone. And so I will just wrap up. So thank you again. Jennie and Stephanie and Jaylene, just for your time here, the work you've done prior, and the ability to just share it all with us today. I know we're all on a different process of learning, but I felt that you really opened the doors to make it a little bit easier and to have a little more confidence going in, building new relationships. So before we end, I would just like to well, no, just say we hope that everyone here enjoyed themselves and also the session. And so after you close the Zoom, you'll have a survey that pops up. We ask you to fill this out if you have the time, and we'll be able to provide that feedback to everyone or provide the feedback to the speakers. And then the registration for the next session in the series is titled Grief and Bereavement, a South Asian Perspective, and that is scheduled for October 27th at noon. And you'll see the link in the chat. And then to be notified of any other sessions in the series, feel free to subscribe to the BC Center for Palliative Care newsletter. We always put those out. And our aim is to provide the recording of this session and summary notes and any other resources mentioned within 7 working days. And we hope so like you can pass it on if you found this information valuable, pass it on to people that maybe weren't here to be able so we all can learn a little bit more. And that is it. So we hope everyone here takes the time to also ground themselves again, because there's a lot to process to understand where we are in these moments, and and the people who aren't coming to our spaces. And I want to sort of, I think that's a great takeaway, is just looking at who is not coming to the spaces and reflecting on that as we sort of move forward today. But hopefully everyone can take a breath and also know that we're working together to build a better world, and it just takes time and it takes effort and it takes a lot of love and learning and repair. And so thank you, the speakers, so much. I'm grateful to be here, and I wish everyone a great day and a great evening.